I am delighted to welcome Glen Moller, the visionary, strategic, and incredibly successful CEO of Upward Health, to this episode of the 100X Entrepreneur. Just a little background for anyone who hasn't read the Upward Health chapter in the 100X Entrepreneur yet. Glen had joined Upward Health to really turn it around from a very small company, which was struggling to deliver healthcare services, to become one of the most successful, fastest growing companies in the United States. 3 times now, year after year, has made it into the top 10 list of the fastest growing companies on the Inc. 5000 list. And most importantly, has done this while increasing not only its revenues and its paying customer base, but the level of services that Upward Health delivers in the healthcare sector to the most challenging patients in the country. So, Glen, I am so grateful and excited to have you as a guest on this 100X Entrepreneur podcast and to hear your own reflections on how Upward Health has achieved this.
Oh, thanks, Mary. I'm super happy to be here. I feel very honored that our company got a spot in your book, which is such a cool book. My wife even read it. It's really, really a good one. And I think I feel especially good about it, and my wife also, because we're both Boston College class of 93. So even nice to have that connection with you as well.
Well, thank you so much for mentioning that. I am a professor of entrepreneurship at Boston College, which is why that is a relevant background comment. And from there, Glen, I'd love to take our listeners back to those early days when you came in as the CEO in a very challenging company and what you did and how you managed to scale it so successfully and with such incredible vision and integrity.
Well, that's a lot of compliments, so thank you for those. I think in business, everything always feels like it's a step back and a step and a half forward, and then another step back. And then just when you think everything's going great, you get punched and then you get tackled. And that's all part of winning. That's kind of the wild thing. So if I look back at the 7 years that I've been at Upward, it has always felt difficult at all times. Right now, it feels difficult. At the beginning, it felt difficult. And, you know, I think life and anything worth accomplishing, there's no victory without a battle. So it's been a series of battles, but it's really nice to reflect at the end of these years, and hear the words that you're saying. Um, and it's been a lot of growth. So, thinking back to the early stages, I had sold a company a year prior, and that company was a real strong success. It was a 15x return on invested capital. We grew that from 30 employees to 1,500 in 5 years, all organic. It was a big success, but some of it felt a little bit hollow to me because we weren't directly serving people in need. We were doing things that were related to, I mean, all good things, but relating to data analysis and compiling medical charts and things like that for health plans. And then I was never sure what was happening with that data. I have a health plan background the first 20 years of my career, and eventually I wound up running health plans. So since then, I've been serving them with these two companies. But when I was, having broken off from that company that I just mentioned, which was called Arrow Health, what I was intent on finding for my next thing was something where my skills, which are business skills, I'm not a clinician, where I could use those skills to directly help as needy people as I could possibly find, and do that on a big scale and do it on a for-profit basis. And some people might wonder why on a for-profit basis. Um, Basically, because that's what I know how to do. That's my background. And I know how to attract capital in a for-profit basis. I know how to attract employees on a for-profit basis. So that was my goal. And Mary, what happened was, I was looking for a larger company. I feel like I'm actually better molding something that exists rather than inventing stuff. That just feels to me like my skill set. Um, and I admire people who can invent stuff, but I don't feel like that's necessarily what I'm best at. And so I was looking for more of a sizable company. I had an investor lined up that was going to, work together with me to purchase it, and then I would run it. And instead, I found a very small company that is now known as Upward Health, which is called Behave Care back then. And it was 20-ish employees and 80-ish patients, one client, which was honestly barely a client. Um, and from there, we were able to build the company that's Upward Health.
Right. And why don't we fast forward to what Upward Health has become? So in 2025, you hit a number of very impressive milestones, as you have, honestly, Glenn, every year you've been at the company. Um, can you spend a few minutes talking about how you lead the company to achieve these growth milestones and care delivery satisfaction and impact milestones, and how that played out in 2025?
Yeah, so maybe I should first share for the sake of the listeners. Upward Health is an in-home primary care medical group. And what we do is we serve individuals who are high risk, high need. That's our mission. We really don't serve anybody else. We're specifically targeted um, to to work with individuals who are, as an example, frail elders or homebound or poor and lacking resources, um, who have multiple chronic conditions. Maybe they're homeless. Maybe they suffer from substance use disorder and other problems that they don't know how to get out of. And our normal medical system is great for the 95% of people who are not like that, but it's not that great usually for the 5% who have those type of characteristics. So our company, going all the way back, 7 years ago, aimed to work and develop all of our skills and capabilities to serve that type of patient. And so for us, what that means is we have to be in the home. So we have no offices. We're a medical group with no office space other than the one I'm sitting in here, but no patient ever comes here. We had to be very mobile. We have to serve individuals in primary care on a physical basis, but also mental and behavioral basis, and also care for them in terms of what's known in our industry as social determinants of health. So helping them with things that they might need to address before they can even think about their healthcare, stuff like food and housing and transportation and loneliness. Um, there's a long list of things like that. So our company provides whole person care for individuals like that. So flashing forward to 2025, to answer your question, we now serve a couple 100,000 patients. We have 800 or so employees, and we're just constantly hiring. We are serving in 5 states and expect to enter a few additionals. And we're working directly with health insurance companies. to serve their needs. Their needs are they want to improve access to care. So we've had to go into very rural places. We've had to go into the inner city. We've had to go into physician deserts where people think, hey, that doesn't sound that possible to do. And we found a way to do things like that. Our health plan clients care about quality of care and the way that the government, which is often who's paying the health plan, what how they score quality of care. They care about patient satisfaction. So these are things that we're and of course they care about cost as well. So these are the things that are important to us and that are helping us to be able to grow as we match the needs of our clients, which are these health insurance companies.
And since we are a podcast and a book about entrepreneurship for entrepreneurs and founders who are aspiring to achieve the kind of scale and success that Upward Health has achieved, I want to ask you to explain for a few minutes your business model that is behind your ability to deliver this kind of care to the most in need, most chronically ill, often with multiple health issues. How have you managed to do that? And I would like to highlight become profitable in and as you continue to grow profitability as a pillar of your ability to scale.
Yes, indeed. Nicely profitable. Which I honestly feel really proud of, not in some trite sense, but when we were first getting into this business, and you give me a lot of accolades, which I appreciate, but this is a team. I mean, this is an awesome senior leadership team that we have at this company, many of whom have been there since those early days, and we're slogging it out in the infant stages that I described. Really, really good people. But, so our business model is exciting to me because we went to really smart individuals, shared with them the vision that we have just to get some input. And pretty much most people said that doesn't really sound like that's going to work. I don't see how you're going to make money doing that. It sounds like a charity. And um, how is that going to work? Maybe it can work in Medicare for the elderly, but there's no way that can work in Medicaid, which is all the budgets are tighter. That's our federal and state government uh, uh, program for the indigent. And we have made it work for all of the above. And the way that we're able to make this work, it took us a while to kind of figure this out, but what we do is we work out an agreement with the health insurance company where we are getting rewarded financially based on how they themselves are doing in terms of their financial success with this group of individuals, call it 5%. So if we're able to produce quality results, access to care results, patient satisfaction results, and cost of care results that are um, helpful to the insurance plan, then we receive based on formulas that are always different from from client to client. We receive compensation based on that. So one of the beautiful, I really think truly beautiful things about what we do is we go in, we are able to make life better for these individuals. We're caring for them in their home. We're available 24/7. We'll go to them in a very tricky circumstance that even Uber drivers won't go to, just to picture that, whether you understand what I mean. And their quality of care and results demonstrably improve. As a result of that, they don't need to go to the hospital as often. They don't need as many yeah, prescriptions. So there's a reduction in the total cost, even though their care is being improved, and even though we're actually seeing them much, much more than they've ever been seen before. And that's the magic of it. And the way that translates to the business model is at the end of the year, the health plan will look at the results and they're able to determine, okay, these metrics improved, our cost of care actually decreased, and based on that, we can share some of that upside with Upward Health, and that's enough for us to make a good business out of it.
Wonderful. Thank you. And two things that you touched on, Glenn, that I'd like to spend another few minutes on. One is, of course, the incredible team. And I'll stop praising you because you clearly want to turn the spotlight on the wonderful people who are working at Upward Health at every level. Um, and tell me about the parts of that team. You mentioned how many people are now working at Upward Health and that you're always hiring. What are the pillars of the skill sets and the service sets that you're providing?
It's such a big question. It's my favorite one too. Um, so the way we're structured is we have we have some corporate staff like your listeners will expect. Out in the field, we have physicians, we have nurse practitioners, we have nurses, psychologists, psychiatrists, we have social workers and community health workers. And we've got a lot of other people who are on the side who are able to help the patients at a moment's notice with what they need. So that's how we're structured. Um, One thing I'm proud of is we had 100 internal promotions last year, which is so exciting. I mean, you want to work for a company that's growing fast and that's changing. If you want to move ahead in your career, that's what we always tell people here. So, like, you've been here for a year, you're like a veteran now. So we've had a lot of opportunity for that. But I would say most important is we're really trying to inculcate values here that are um, patient first, team first values. And these values really permeate every part of what we do. They're a significant part of how we hire people. They're a significant part of whom we choose to promote. They're a key in terms of how we rate people each year. Um, in terms of how much of a bonus they receive, in terms of how much of a annual compensation merit increase they get. Everything is based on these values, and we print them all over the office over here. They're on everyone's startup screen on their computer. We preach these things like they're the gospel, and for us they are. And so what we're doing is, the first value is the patient comes first. And whatever it takes to serve that patient and make life good for that patient, it just has to overrule everything. That's kind of rule one around here. We're trying to hire people who really deeply care about patients who are in a sticky spot. And Mary, we've had to lose individuals here who were otherwise excellent at their job, and they just didn't care that much about the patient, and sometimes out loud.
Mm.
Um, and so we really try to stick to these values. We have a quarterly town hall meeting that we do with all hands. It's virtual, kind of the way you and I are talking here. We got a lot of faces on a lot of screens on those calls now. And each quarter we're going through one of our six values. I'd love to kind of share what all of those are, but we don't really have time. But for me, what underpins them is it's a focus on taking other people seriously and yourself not as much. It says you're going to get rewarded based on your service to the team. How
And
well
Glenn,
are you?
I can see how you model that every day. And I can see how you're modeling that right now on this episode of the 100X Entrepreneur. So thank you. And I will just interject here that those values, which I had the privilege of seeing on the wall at headquarters and everywhere, they are in detail in the chapter in the 100X Entrepreneur book. So if you want to really understand how this foundation of value and culture and teamwork and patient first above all has turned into scalable financial success for Upward Health. You can see that in the chapter. And one more question I'm just going to touch on because it's also in the longer write-up in the book is clearly you need a lot of analytics and data to move through the patient care and how to improve that, and also through your contracting and how to document these positive outcomes from a business point of view. Can you just briefly talk about how analytics play a role in the company?
What's wild is that we wind up with more data on our patients than anyone has ever had before, or maybe honestly than anyone like could have. So, and the reason for that is we get all the data that the insurance company gets. Um, Everything coming from all the providers, everything coming from pharmacy, everything coming from the hospitals, everything that the health plan has, everything their customer service has, and what we add on top of that now is very intimate knowledge of that patient, what it's like in their home, uh, what what are they doing for nutrition, what's actually in their medicine cabinet. The only way to really know a patient, especially a high need one, is to see where they live and what life is like for them. Who's taking care of them? What's happening at 3 in the morning? What's in that refrigerator? Really, not what do they say, but like what's really there. So we have giant amounts of data. We've made it a tremendous focus of ours to be smart and have a big heart. And the way we're trying to be smart is to use all the modern tools that exist now and are getting better and better to sift through all that data for a couple 100,000 individuals and be able to know exactly when do you reach which patient in which way. That's kind of the key. So it's kind of mass customization. And I feel good about where we're headed, but we also have a ways to go.
And we'll get to that as we wrap up. And moving in that direction, I always like to ask the guest on the 100X Entrepreneur what advice they might like to share with new founders, aspiring 100X entrepreneurs, people who are joining a company to lead it in the direction that you have led Upward Health. So, could you spend a minute just sharing some advice from your experience, Glenn?
Yeah. Look, back to the values real quick. I think it's very easy to step away from your values when things get tough, and you have every way to justify it to yourself and just every possible way to justify it. But it's not right. It's not good, and in the long run, that's not right. So what we have chosen to do here, and I'm not alone in this by any means. I feel like I'm completely joined with the whole team, is we are just solid to these values no matter what. And we talk about them a lot. So it would be really difficult and embarrassing like to make an exception. Like you just really can't do it. You'd be a complete hypocrite if you ever change. So we're very vocal about it. It has to start with the CEO and it has to go to the executive team and it has to go all through the organization. So I'm sure we're not perfect, but we're really honest to God trying to be. So my advice to CEOs is find that within you and do it and stick to it, no matter how many times you get punched in the face and it's easier not to. I would say second, I know I sound very like love and peace here, but at the same time, one of our values is we execute. And it talks about how this is a performance driven culture and we expect top performance out of everybody, including me. And one of the problems with having a fast growing company is as you get bigger, some people are meant to be in a smaller company. They're not, the needs of a larger company are just very different. The skill sets required are different. And sometimes you have to make difficult decisions with individuals who may not fit. You may really love them as a person. So we've had numerous situations like that. But as a CEO, your job is to make sure that you're making difficult decisions when you have to for the betterment of the larger things that are at stake. Um, and then finally, I would share, I really feel like every quarter feels different here. And I'm like, whoa, I better up my game here. I better get on this. I'm not sure, that I'm adapting fast enough to some of the things that are going on here. I need to play more of an external role than an internal role is a thought that I've had very much over the last 6 to 9 months. And that's kind of different. There are people better than me at tinkering with how we do things internally. A CEO at this stage company here needs to get us to the next stage in part by um, working on an external level and having a more strategic outlook than what it takes to get you from 20 employees to 50 or to 100. So those are maybe the three things I would pass on to other CEOs.
Thank you. And that's both a piece of advice for every leader of a high growth company is it's well known and in venture capitalists often enforce this. It sounds like you have an internal compass that is telling you that, some people are better at the startup early growth stage. Some people are particularly talented at the scalability stage, and others shine when you're feeling that call to be the external representative and to really delegate some of the internal decisions. And so, yes, that's good advice and also kind of wisdom. I think that has to come to every founder if they are looking to grow beyond a certain stage. Are they the right person to take the lead? And that's also a perfect segue to our wrap up and my final question, Glenn, which is what are you looking forward to in 2026 and beyond in terms of um, if you would address it for at least a bit, your own internal um, personal challenges as the leader and the CEO of Upward Health, and then the services that you are providing, the patient first quality of care services that you're providing, and then inevitably your business growth. So, three final wrap up questions in one, if you don't mind.
Three for the price of one. That's good. I'm super excited about this year, and we're even thinking about next year quite a bit already, believe it or not. So what we're trying to do is take this beautiful thing. I hope that doesn't sound too like arrogant to say. We think all of us in this company where we're like we really feel like what we're doing is beautiful. On a scale from 1 to 10, Mary, our patients 30,000 responses. Okay, in 30,000 responses, 9.7 out of a scale from 1 to 10 in terms of how they rate their experience with Upward Health. So something good is happening. We have so many testimonials. It's really beautiful. What I want to do is blow that out to as big a scale as we possibly can. I want as many people helped by this vehicle as possible. But what we're always conscious of is we're only going to do this at a level where we can do it with excellence. And that's it's sometimes hard to figure that out. And you've got to do that well, you have to think forward like 3 to 6 months and temper the growth sometimes, which we have done frequently. And sometimes we've gotten it a little bit wrong, but like it's always on our mind. So number one is we really want to continue expanding. Number two, we want to grow in the sophistication of what we do. A lot of times when you grow fast, what you're doing is not as efficient as it could be. And efficiency is important. At some point, we're spending someone's dollar to do this. And so we're re-engineering some of our efforts this year in terms of analyzing processes. To your point earlier about technology, making sure that we have the right and the most modern technology underpinning what we do. And we have a whole process in place for this company as we continue growing to optimize more and more of the operations that we've had to kind of build quickly. So I'm excited about where that goes. And then thirdly, we really have a lot of effort underway to just work with care coordination, quality of care, being able to demonstrate that the care that we're delivering is of the utmost quality and that it's better than anything that can be compared to. We work with the hardest patients to manage. They're always at the bottom side of a health plan's charts in terms of the different types of metrics that we've talked about. We're trying to have these most difficult patients be actually at the top so that they're actually demonstrating the best medication adherence, um, the most appropriate utilization, highest satisfaction, high quality scores, and so many ways to measure that. So yes, this may take us a while. I don't think we're going to hit it all in 2026, but that's what we're shooting for.
That is so inspiring. And you hit on some of the challenges that you are thinking about as long-term strengthening your foundations for the future. I'd like to end by just asking what you're personally most excited about in looking ahead in this year and 2 or 3 years out. What gets you up in the morning excited to come to work or go to bed at night still thinking about the good things that are going to happen tomorrow, Glenn?
Mhm. We did this interesting exercise with our senior leadership team where we all had to draw a pie chart of what motivates you. And there were so many different answers, and so mine was, I'll tell you what mine was, but it's not the same as everybody else's. I was glad we did it because I learned a lot about each person. I feel that I'm pretty equally motivated by the business part of this. Maybe that's obvious. Um, I feel tremendously motivated by using my skills to do a good thing in the world. Feel super motivated by that. And the more of it, the better, and the higher quality of it, the better. One of the things I love is to do ride-alongs with our clinicians out in the field and see in the home what our patients are up against. And it's heart-wrenching a lot of the time. And to be able to make a company on a mass level provide relief to those people, that to me is what gets me up in the morning. That's really what makes me tick. And my third thing, I would say, maybe it's equal to the other three, or the other two. The third thing is I love the people I work with here. We're friends. We spend so much time together. We suffer together. We triumph together. We really feel like we're in this thing together. And so ultimately, that's one of the great things about being a CEO is you can control maybe more than other positions who you're surrounded by, because ultimately it's your decision. It's not that simple, but ultimately it is. And I can tell you, I work with people that I really admire, that I just think are the greatest, and I'm proud to be associated with them. So that's my third thing.
Thank you, Glenn Moller, so much for talking about the personal side on the culture and the team and the foundations of Upward Health, and importantly, for mentioning honestly how business and growth and profitability are one important part of your job and your life, an essential part, of course, equally how important your clients, the patients, the people you go out on the road to see and visit along with the caregivers. That's so impressive and so powerful. And the people you work with every day. I'm sure they're glad to see you show up in the morning as well. So
Hope so.
thank you so much for this insightful, powerful interview and update on the continuing challenges and success and future growth and impact of Upward Health with Glen Moller, the CEO. Thank you, Glenn.
Thanks again, Mary.